Hi, I'm Dr. Matthew Samra. I'm a vascular surgeon. I work at the Vascular Institute. Peripheral arterial disease is a chronic condition that's basically from hardening of the arteries or atherosclerosis. We say it's chronic because once that process starts, it's very difficult to mitigate. So PAD does have some risk factors associated. Family history is definitely one of them. Diabetes mellitus, high blood pressure, high cholesterol, and most importantly, smoking are the most common risk factors that we see that causes peripheral arterial disease. A lot of times, peripheral arterial disease is very silent in its onset. You can walk without problems, you can live your life. Eventually though, as the peripheral arterial disease or the hardening of the arteries gets worse, you might start to have some cramping in your calf when you're walking. You might have some pain in your abdomen while you're eating. These are the most common things that we see in peripheral arterial disease. So lifestyle modification is among the most important things that a person can do to treat and potentially reverse peripheral arterial disease. I tell patients the worst thing that you could possibly do is smoke. Also though, eating well, losing weight, controlling diet, maintaining a good blood sugar and normal blood pressure are very important things. Exercise is probably among the top 5 most important things a person can do. I recommend that people walk every day and try to stay with an exercise program. I think that'll prevent PAD. So when somebody comes to me with peripheral arterial disease, I look at the system, and basically you look at the system, but then you look at the whole patient. Our peripheral arterial disease is a global issue that that happens pretty much anywhere. So if somebody comes to me with leg pain, with walking, you put them on medication. You tell them to take aspirin or silastazole or Plavix or whatever you have, and you put them on a walking program. If that doesn't improve their symptoms, then obviously at that point they need treatment. If somebody has asymptomatic carotid artery stenosis, you can treat that either with carotid artery surgery or stenting. If somebody has chronic mesenteric ischemia and weight loss, sometimes you have to treat that either with a stent or open surgery. These are all things that we look at. When a patient comes to me and they've been seen by their primary doctor or their cardiologist and they're told that they have peripheral arterial disease or atherosclerosis, as a vascular provider, as a vascular surgeon, I'm looking at the patient from the top to the bottom. I'm seeing where else do they have this. And the most important thing that I tell them is lifestyle modification is the most important thing. At this point, you have to maintain a good, healthy diet. Exercise 30 minutes a day is very useful in treating peripheral arterial disease. Maintaining glucose and keeping diabetes at bay is also very important. Maintaining a good blood pressure and taking a cholesterol medication, also very important. I try to work in tandem with the primary care doctors and the cardiologists for a complete treatment for a patient with peripheral arterial disease. I want to thank you for your attention and for watching this video. For more information, don't hesitate to either reach out to our main office, which you can find at our website, www.vi-ami.com.